Hello everyone, wishing all of you a very happy World Homeopathy Day. On this auspicious day, I take this opportunity to thank our Master Hahnemann for giving us this wonderful science called as homeopathy. Whatever and wherever I am today, it is only because of homeopathy. So it is an honor for me to be sharing my thoughts today on polarity analysis, which has increased my confidence to another level in taking up challenging acute cases like pancreatitis, swine flu, renal colics, dengue, etc. with ease, and most importantly give results on consistent basis, which has given me a lot of satisfaction as a physician. Next is these wonderful teachers, and I feel so fortunate to sit right next to them and further our science and take it to another level. I have been fortunate to learn from Sethia sir, Khare sir and Pankaj sir during my initial days of my college years, studying years, and they gave me an ample opportunity to take cases right from that time. With all this wisdom that I have got from my gurus, I would like to share a case of acute pancreatitis treated on OPD basis. This case is special because it has been solved on polarity analysis, which I attended the seminar organized by the other song in the year 2015, and what struck me or impressed me is the consistency of the results which it gives. In Dr. Heiner Fry sir's evaluation, he claims that it is effective in 87% of his practice. Now this kind of consistency was something which I was very impressed upon. So what I did, I started applying this aspect or approach since 2015, and I saw that the results are really very good. And to my surprise, I could come around 80% in treating acute cases, and that is how I got converted or motivated to learn more about polarity analysis. So this is a case of an acute exacerbation of chronic pancreatitis. A 17-year-old boy was brought to us for recurring attacks of pancreatitis. Each month he had to be taken to the hospital with elevated serum amylase lipase level and severe pain in the abdomen. Now imagine the plight of the patient and the family, where every month he gets a stomach pain and he lands up in the hospital. And how he came to know about the other song is that one of the patient who was next to him, he recommended that he goes to this place, and that is how he landed to us. After doing his case thoroughly, we came to a particular remedy and started him on treatment. Whichever chronic patient comes to us, we inform the parents or the patient that during any acute problem, they have to get in touch with us before taking any allopathic medicines. So after a month or two of starting treatment, he develops an acute pain in the abdomen which is resembling pancreatitis. The parents call me that such and such is the case. I tell the parent that you bring him to the clinic. So he comes to the clinic and he says, he just lies down on the bed and he opens his shirt because he cannot bear the covering of his shirt, and he says switch on the AC. And he lies down on the back, but lying on the back is more painful. He is very restless and he is tossing and turning in pain. We take his symptoms and he says any kind of movement makes it worse. Lying on the back makes it worse. He feels better if he lies on the opposite, that is the painless side, better by rubbing the affected part. We observe that the more I am questioning the child, the more he is getting irritable and restless. And the mother says he is drinking more water since the pain. So we prescribe him a particular remedy. Same day in the evening, I take the follow-up and the pain is better by 50%. He is advised to have only liquids. Next day morning, there was pain at night, so the mother gave a painkiller. Then I ask the parent to take the medicines every 3 hourly. Next day evening, the pain is better 60%. He is advised only liquids. Day 3 morning, pain is less. He feels hungry. He is advised to be on liquids only. Day 3 evening, pain 80% better, irritable because he is hungry. Continue the medicines 3 hourly. Day 4, mild pain on movements. Otherwise much better. Keep him only on liquids. Day 5, no pain. Stop the medicines. Start little solid or semi-solid food. The remedy that he received is iodine, based on polarity analysis. Now what do we know about iodine? Iodine, we all know, is the remedy which has affinity for glands. It is a hot remedy. Our patient wanted to be in an AC room. In Boric we see ravenous hunger, much thirst and pancreatic disease. Most of us, when we begin our practice, are faced with many challenges, especially tackling acute cases using homeopathy. From my experience, the percentage of relief I give my patients has increased substantially using the polarity analysis. Polarity analysis is an additional tool to what we are already doing. It is not a replacement or substitute to your current method or approach of practice. In cases where you get stuck and find it difficult to help the patient, use this approach and see it for yourself, the kind of success you get compared to what you are already doing.